Welcome back this week for part 2 of our chronic prostatitis pelvic pain syndrome series. Last week in part 1, we covered more of the science and research side of the disease. This week, we'll be getting the MD perspective, and I'm excited to have on the show men's health expert, Dr. Joshua Gonzalez, who is a board-certified and fellowship-trained urologist. He will get you up to speed with what you need to know about chronic prostatitis and chronic pelvic pain syndrome, so stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Dr. Gonzalez, welcome to the Prostate Health Podcast.
Thanks for having me.
So, Dr. Gonzalez, for our listeners, I thought it would be helpful to first review what is prostatitis.
So the way I kind of explain it to my patients is that prostatitis can indicate either infection, which is traditionally how we think of it, or inflammation in the prostate or in the nearby pelvis. So it can be sort of a UTI gone mad, meaning it's just a more complex version of a urinary tract infection, or it can be from inflammation that's been sort of stirred up in the pelvis and prostate.
And also for our listeners, how common is prostatitis?
So I think the numbers in terms of prevalence indicate that it's about 10% of men will have prostatitis. We'll probably get into this in a minute, but there are different types of prostatitis. So there are some that are certainly more common than others. But I think if you're just taking all comers in terms of men who are diagnosed with prostatitis, it's about 10%.
So what are the different types of prostatitis?
So I think the main distinction initially is between acute prostatitis and chronic. And the acute form is typically from an infection. So in this case, a bacterial infection. I explain it to my patients as sort of like a complex urinary tract infection or UTI gone bad. And so, patients with acute bacterial prostatitis are often presenting with symptoms that you would associate with an infection. So we're talking about fever, and sometimes that fever can be, high, 102 and sometimes higher. Pretty severe burning when they urinate, sometimes blood in their urine, urinary frequency, urgency. They can sometimes have blood in their ejaculate. And, patients with that kind of prostatitis can sometimes get very sick and require even hospitalization. So they present with a very different picture than patients with the chronic form of prostatitis. Then there are the chronic types where you can have chronic non-bacterial prostatitis. You can have chronic bacterial prostatitis. And then you can have what's sort of grouped as like a chronic prostatitis pelvic pain syndrome, which is, at least in my practice, probably what I see the most. And that typically is when the symptoms are present for a prolonged period of time. So we're talking like months in this case.
And so what are some of the common signs and symptoms of each of these different types of prostatitis?
So initially, I think it's not that easy it's pretty straightforward to figure out whether it's acute versus chronic. Oftentimes the patients with acute prostatitis, again, they're coming in generally more sick, reporting things like fever, severe burning when they urinate, frequency, urgency, sometimes blood in their urine or blood in their ejaculate. And then the chronic form can oftentimes be more subtle. So patients will describe, the frequency, urgency, sometimes intermittent or weakened urinary stream. Sometimes they're having to strain to urinate. Sometimes they can have pain with urination, but sometimes they don't. And then a whole host of sort of pain symptoms. So men that I see will report sometimes lower abdominal pain in their scrotum, pain in their perineum, perirectal pain, and sometimes that pain can occur with urination and sometimes it can occur separate from urination. And a lot of times, one of the sort of clues that I get from a lot of patients that I see is that they will report that their symptoms get worse or flare after ejaculation. And so that's kind of a clue to me that they may have this sort of chronic form of the condition.
Could you walk our listeners through maybe what they might expect at a clinic visit while being evaluated for possible prostatitis, and maybe what sort of examinations and testing that they may possibly undergo?
So, generally we'll start with the basics, kind of checking your vital signs. So, making sure that you're not having a fever or that your heart rate isn't running fast. Those are sort of signs that you may have an acute infection. Blood work may be done. Sometimes if acute prostatitis is suspected, or, in general, when we think there may be a process going on within the prostate, we can check a blood test called a PSA, which is generally used to screen for prostate cancer, but can be elevated in some forms of prostatitis. We will typically check a urine sample to look for signs of an infection. We often will perform a prostate exam to get a sense of, does the prostate feel acutely infected? Does it feel enlarged, which may indicate that this is more of like a chronic process? And sometimes we can perform what's sort of called a prostate massage and collect, which will sometimes allow for secretion of prostatic fluid into the urethra, and then collect a urine sample after that to sort of investigate whether the infection is sort of deeper in the genital tract and because it may not appear in just an initial urine sample.
And how would you say the treatment, how does it differ when looking at the different types of prostatitis?
So the acute form is, as I mentioned, often an infection. So we treat that with antibiotics, and we do our best to, target the antibiotics. If a patient's really sick, we may not be able to wait for the urine culture, and we may start them on sort of broad spectrum antibiotics. But in general, we'll wait till that culture comes back if they're not, severely sick, and put them on antibiotics targeted to the bacteria that we find on our testing. But I already kind of mentioned that the most common chronic form is actually non-infectious. And so many of those men, I will still go through the process of ruling out an infection. And oftentimes their urine samples will come back with no evidence of bacteria. Sometimes we even collect a semen sample and culture that, and that often comes back negative. So in those patients, we're treating them primarily with an anti-inflammatory. And what I think is probably the most important part of this to help their symptoms from the chronic form is to refer them to a pelvic floor physical therapist. So we do that a lot. I refer to pelvic floor PT every day in my practice, and I have to sort of take the time to explain what that is, because when patients come in, they oftentimes assume that it's an infection. And so I have to kind of educate them on why this is not an infection and how the muscles in their pelvis are often the cause of their sort of lingering symptoms. And so without the physical therapy component, they will very often have recurrence of their symptoms. They may feel initially better on the anti-inflammatory alone, but if they don't go through the process of doing the physical therapy, their symptoms are very likely to come back.
Now, besides medication, you mentioned physical therapy. Do you find any other additional treatment options available for some of the men struggling with this problem?
So if there is a significant muscle component, I will, have a conversation with their physical therapist and talk to them about possibly putting them on muscle relaxants, because some men need help actively relaxing their muscles. Those are we use those kind of sparingly because they can be somewhat sedating. And there's other medications that help men's urinary symptoms. So I will often put them on alpha blockers, which are a type of medication to kind of I tell them to sort of open the urinary channel so that they can empty their bladder better. It often will help with their stream, their frequency, their urgency, helps them empty their bladder more completely. But if I really think that it's related to a pelvic floor muscle dysfunction, I often will put them on those medications temporarily, just provide some symptom relief and tell them that, once you get through the physical therapy, we're probably going to be able to take you off this medication. There's some other medicines as well. There's like daily Cialis. There's a couple studies that have shown that it can be helpful in chronic prostatitis setting. So we use that on occasion. And then there's some other medications like Pyridium, things that sort of just soothe the bladder and can help with the burning sensation if men are really complaining of that.
Have you found any men that have any issues with things in their diet that may kind of trigger some of these episodes? Or are there any other kind of more behavioral things that you have seen that may be helpful in managing this condition?
So, oftentimes when people have prostatitis, they'll report that certain foods or, like you're saying, sort of behavioral activities that kind of flare their symptoms. Classically, it's sort of spicy foods that are high in acid. So, for the time being, I will often tell them to sort of refrain from eating those foods. Alcohol can sometimes be a trigger, so they may need to take a break from drinking for a bit while they're, going through the process of fixing this problem. So yeah, certainly if they're reporting that foods or alcohol or any kind of other behavior is flare, then I will tell them to avoid that. A lot of my chronic prostatitis patients report certain activities. It's not necessarily like food and alcohol. It'll be, when I work out and do leg day and they're lifting really heavy, that puts a lot of tension in the core and in the pelvic muscles, and that can often flare their symptoms. Or, someone who cycles a lot may report that when they do a cycling class, everyone's at home, right now during quarantine. So there's a lot of people on Pelotons. And so, I have patients come in and say, yeah, I've just been riding like crazy because I can't go to the gym, and they're coming in with these symptoms. And I say, I think it's great you're trying to stay active during the pandemic, but you may want to avoid the cycling or take, the other types of Peloton classes that don't involve riding just for now until.
Well, that's excellent points there. And so in summary, prostatitis is a common, often painful condition, really can affect men of all ages. And the treatment is often really tailored accordingly after determining which type of prostatitis we're dealing with. So Dr. Gonzalez, any final or additional thoughts today for our listeners?
I would just say that, I'd want to stress that prostatitis is very common, but about 90 to 95% of cases are non-infectious chronic prostatitis. And I really try to hammer home for my patients that I don't even like the term prostatitis because it doesn't really capture the source of the problem. And so I would say, if you are going to see somebody and you're given this diagnosis and they are sort of reflexively putting you on antibiotics without any proof of an infection, you may get some relief from those antibiotics, primarily because they work very strongly as anti-inflammatory medications. But if the symptoms come back, then you may want to pursue other avenues of treatment, in this case, specifically pelvic floor physical therapy, because it can really be life-changing and essentially cure the problem as opposed to sort of manage it so that it, doesn't continue to happen.
Well, it really was a pleasure having you on the show today. You've definitely given our listeners some valuable information that will really help improve and empower them in their prostate journey. I think I can speak on behalf of all of our podcast listeners that we appreciate you taking time out of your busy schedule to chat with us today. Thank you again.
Yeah, thanks for having me.
Thank you again for listening to the Prostate Health Podcast. Follow me on Twitter and Instagram at gpullmanmd. Don't forget to join us next week for another episode.